Hi everyone, my name is Melanie Grant and this is C&M Glass. Welcome back as we talk about part 2 of our OBGYN on our topic for coding pregnancies and labor and delivery. So we're on part 2 of a 2-part video talking about coding for the maternity system. And already we've discussed a little bit about routine care and genital urinary complications and where to find those codes. We'll be going into more details about those in each of the body systems when we talk about genital urinary. So make sure you stay tuned in future videos for that. Now, let's talk a little bit about pregnancy. So there's a lot of different conditions for pregnant patients. You have just your normal run-of-the-mill pregnancies, your encounters to determine pregnancy, okay, and of course you have complications. And each of these have different types of codes that you need to list in addition to, well, a couple other items. Some of them are weeks of gestation, and if they deliver, then you want outcomes of delivery. So we'll talk about those here in just a minute. Let's start first with just your basic run-of-the-mill normal pregnancies. Now, the first thing you want to talk about before you know that a patient has a normal pregnancy, we always need to confirm it in the office. And so we're going to do a screening for pregnancy, and there's 3 different types found in our Z32 category. So Z32, if you look in your ICD-10-CM codebook, which I'm using the AAPC Expert Edition 2019 ICD-10-CM. So I go to category Z32, and I find that on page 1267, and I see here category code Z32 is encounter for pregnancy tests and childbirth and child care instruction. Okay, so if they're getting seen about childbirth or child care, this would also go to this category. But we're going to find our pregnancy screenings under Z32.0. So this is always going to be Z32.0 dash. And there's 3 different options. Either in the documentation, the results of the pregnancy screening was unknown, the results of the pregnancy screening was positive, or it was negative. And keep in mind, if it's not stated, we can never assume that they're pregnant, even if the provider starts talking about treatment. Now, this might be a good point to make, that if you see information talking about upcoming pregnancy or treatment, you may want to verify with the provider through a query or your policies within your office as to whether or not treatment for pregnancy or planning for pregnancy treatment and care indicates a reason to put a positive reading on that. So the provider does have to indicate that test result for us to code this. Now, once we know the test result, we're also going to code the patient for a pregnancy, and if it's normal, meaning no documented complications, then you're going to find that under supervision of normal pregnancy or encounter for, and this is category Z34. Okay, so I'm going to flip now in my book. Well, I don't need to flip the page actually, it's not very far. I'll find the normal pregnancies on the same page, 1267, and Z34 as a category does have some excludes notes. So always make sure you're looking at these before you continue on. This is why it's really important we read up and down, because sometimes that excludes note will tell you exactly where you need to find the code you're looking for before you select the incorrect code. So here it gives me any complications are excluded, and you would instead code to O00 through O9A. And so that's these codes here. And notice how I write my O00 through O9A. It's very important that you make a distinction on these, especially when you're submitting your coding, if you're doing assignments or if you're turning in coding to an insurance. Always use capital O's and make sure to pay attention to the difference between the O and the 0, because if it's incorrect, it's incorrect. So you don't want to get the wrong code just because of a typo. Now on here, if it excludes, and it's an excludes 1, that means that you would not use normal pregnancy code Z34 category with any complication codes. Now it also has excludes for encounters for pregnancy tests under Z32, meaning that if they came in and did the initial pregnancy screening or the testing, you would not code both of these together because the purpose of seeing them is for the screening today. They believed they were pregnant, we confirmed it, and we started their care, but we had to have that screening first. And of course, if there's a supervision of high-risk pregnancy, that goes to 009. Okay, so we'll look at those here in a minute. Now, Z34 has 3 different breakdowns. You have first pregnancy, other normal pregnancies, and pregnancies unspecified. How would you know that in your note? One easy, quick way is to look for documentation of GNP. Okay, so your GP, and I am going to look at the spelling here, is gravida and para or parity. Okay, and so this is talking about how many pregnancies Okay, so if they have G1P1, that means that they've had 1 pregnancy before and they've delivered. In this case, you would actually not have G1P1 if you were seeing them for their first pregnancy. And then your para, I'm just going to put para there, is indicating how many births. Okay, so if they have, let's say, a G3P0, that means that they've been pregnant 3 times but have not given birth to a live-born. Okay, so something has happened, either a loss of the baby or something else to cause them not to give birth to live-born. So that's where you're going to find information when selecting your Z34. Now, the provider should be indicating this, but you can use that indicator. So if it's their first pregnancy, then they're going to have a G0P0 before they're identified as pregnant, or a G1P0 to indicate that. So you'll want to identify if this is their first normal pregnancy, and then it breaks down by trimester. Okay, so it's just a couple of steps. It's nothing too major. When you're coding in OBGYN and you're coding for pregnant moms, you get to the habit of doing these over and over again. But when you're first starting off, it's important to take it slow, make sure to read up and down. So how do we identify trimesters? In our coding manual, we identify them by their first, second, and third trimester, which is identified with this little chart here. You have 0 days to 13 weeks and under 14 weeks, 0 days, meaning 13 weeks and 6 days. Now, one of the things to keep in mind is that your very first week starts at the first day of their last menstrual period. Okay, so for those of you that took biology, you should know that a woman is not pregnant until approximately 2 weeks after her last menstrual period, when her body ovulates. But we don't track it based off of ovulation because not every woman is the same. Some women may ovulate 2 weeks after their last period began. Some of them, however, may ovulate somewhere else during the cycle. And so to make it consistent for tracking purposes, we always go based off of the first day of her last menstrual period, meaning that there's a 2-week add-on where she wasn't technically pregnant, but we count it as pregnancy weeks because we count it from her last period. So if we're looking at this, when we say 0 to 13 weeks, her 0 week is the day that she was last on her period, and most women don't know until about 2 weeks in during their first trimester. So whenever you're counting this, you want to identify what trimester based off of her last menstrual period and how many weeks and days that has been. Your first trimester is your 0 to 13. Your second is 14 weeks to 27 weeks and 6 days. And then your third trimester is anything from 28 days and on. We have also some identification of terms here, your preterm, post-term neonates, and prolonged gestation of neonates are under 28 days. Post-term is after 40 full days, so 40 weeks and 1 day, up to 42 weeks, and then after 42 weeks or 294 days of pregnancy is considered prolonged gestation. So these terms are important to remember to identify when you're coding for pregnancy, because if you have these conditions, there's additional codes that you would list. Okay, so we'll talk about those here in just a moment. But just your run-of-the-mill normal pregnancy, you're always going to have your Z34 for the normal pregnancy based off of if it's her first, other, or unspecified number of pregnancies. So it's either her first or it's past her first if it's specified, and if it's not specified, we have to use that unspecified code. And then identify the number of what trimester she's in. Now, while we're on weeks, you also have a weeks of gestation code, which is going to be listed every time that we encounter this pregnant patient. Okay, weeks of gestation is going to go to all of these. And this is going to be your weeks of gestation. If we flip one page, is your Z3A's dot. Okay, so this is one of those areas where we're more alpha than numeric. And if you look at Z3A dot, this one is one of the easiest ones to remember. So Z3A dot, what week is it? Okay. So we always want to list this, and if you look on the bottom of page 1268, you'll see that it breaks down. Z3A.0 is if it's not specified or less than 8 weeks. And then it says Z3A.08, 09, Z3A.10, and you'll notice that those count up based off of the number of weeks. So if it's under 8 weeks, you're going to have your 01, and then after 8 weeks and starting on 8 weeks, it just counts up with each week of gestation, and it goes all the way up to 42, and then greater than 42 for your prolonged gestations are going to be Z3A.49. Now, one of the things you'll notice here under category Z3A is weeks of gestation has a note where codes from category Z3A are for use only on the maternal record to indicate weeks of gestation of the pregnancy if known, meaning that we do not list the weeks of gestation for the baby, only for mom. Also, there's a code first indicator that says code first complications of pregnancy, childbirth, and puerperium, codes 009 through 09A. So that's going to be listed when they apply. Okay? So always code first, meaning that these go first on the chart. Same thing with your normal pregnancies. You'll want to list those first on the chart. Okay, so that's it for most of your normal pregnancies. There is, however, one additional code you should be aware of with a pregnant patient is Z33. So if we flip back over to Z33 and we look at Z33.1, or just start with category Z33, always read category code first. This is for patients who are being seen for incidental pregnancies. So they're coming in, they have the flu. And the flu is not caused by their pregnancy. However, because they're pregnant, medications that are prescribed and treatment may be different. And so if you remember your coding guidelines, we always code anything that may affect the patient's care and treatment for today's visit. And being pregnant is one of those. However, we're not supervising the patient for their pregnancy. And so category Z33 dot is going to be listed, and in this case, .1 for a pregnant state incidental. Now you have other options for encounters for elective termination of pregnancy, as well as gestational carrier. So if they're getting seen for counseling and they're carrying a baby, that is one of the differences. But in this case, Z33.1 would always be listed anytime they're seen while pregnant for something not related to their pregnancy. And if you remember your guidelines, your code first is always the reason for the visit, and so this is always a second code. And so if they're getting seen, and we said earlier, for example, they have the flu, you would have acute upper respiratory infection due to influenza, which we'll talk about much later on in another video when we talk about coding respiratory conditions. But, for pregnant patients, you'll find the code that applies and for the reason they're seen and lists that Z33.1 anytime they're seen and the pregnancy is incidental. Okay, and you can pick that up anywhere within the note if the doctor documents that they are pregnant, even if he or she does not list it in the assessment, because it does affect the patient. All right, so let's move on to the next part, which is complications of pregnancy and, of course, the labor and delivery itself, because there's a couple more codes that you'll want to be aware of and that fall under here. So I'm going to just kind of clear off our board a little bit here. Now, the thing about complications, as I mentioned earlier, you'll still need to list the weeks of gestation, but with complication codes, instead of encounters for supervision of a normal pregnancy, you have whatever the complication caused by the pregnancy is. Now, it's important to identify, was the reason of the complication something they had before being pregnant or caused by pregnancy? Okay, one example of that would be patients that are seen for hypertension. Now, hypertension as a condition due to pregnancy is a complication of pregnancy. Hypertension prior to pregnancy needs to be identified if it's causing complications to pregnancy, and you'll want to identify that they had hypertension prior. Another one is gestational diabetes versus diabetic patients who are also pregnant. The difference being a patient with gestational diabetes, which happens to a lot of new moms and a lot of moms in general, is a condition where their blood sugars are going crazy, like diabetes. It's the exact same symptoms, but it's caused by the pregnancy itself. Okay? And so based off of the reason that they are having the diabetes is how you're going to identify whether or not it's a pre-existing condition, which codes to the condition category, or complications of pregnancy. Okay? Now, our chapter 15 of the ICD-10-CM, we're still in chapter 17 of the Lex Code It, section 17.6 for pregnancies with complications. And you can read some of the information that are in here regarding pre-existing conditions versus gestational conditions. So when we talk about coding chapters, I'm referring to, of course, to our ICD-10-CM, which I'm referring to my book here. And I'm looking over at the coding chapter 15 that starts on page 885 of my coding book. Now, I love my book because it gives me a lot of details regarding the female system. It gives me like a little anatomy and of the female reproductive system and just some terms in different areas that I can find information, as well as common pathologies and details about the stages of pregnancy and delivery. Okay, so that's some really cool information that we can look at. And if you have the expert edition, it's really good when you're taking coding tests because you can kind of reference it if you get lost. Not to say that you should be referencing all of it when you're sitting for an exam. Now, it starts really on page 887, and there are some notes in this chapter of the coding chapters that apply to everything under 000 through 09A. So always look, when you're starting a new chapter, when you're looking at something, take a look at the coding chapter, notes, exclusions, and information. Now, it does have notes that coding from this chapter are for use only on maternal records. This is really important because we see a lot of babes with mother codes and vice versa. It also says to use additional code for category Z3A, weeks of gestation. And this is used as additional, meaning that it's a secondary code every time to specify the week of pregnancy. It also includes supervision of a normal pregnancy, which we just talked about, and it excludes mental and behavioral disorders associated with the periperium or the postpartum type mental disorders, and they gave us a couple examples we can look at. Now, they have different coding blocks for the different categories. We have pregnancies with abortive outcomes, and so you would look at codes 000 through 008 if there's any kind of abortion. Keep in mind the term abortion does not always mean elected ending or termination of a pregnancy. It means the termination of a pregnancy. And there's different types. There's a little bit of information I've provided on that. We have supervision of a high-risk pregnancy, which we'll look at in just a minute on 009. And then we have different categories such as edemas and proteinurias, hypertension and hypertensive disorders, maternal disorders predominantly related to pregnancy, maternal care related to the fetus and amniotic cavity and possible delivery problems. So if the patient is a high-risk pregnancy due to complications with the baby or the fetus, not with herself, you would go under the blocks for 030 through 048. Complications of labor and delivery. So she may have had a normal pregnancy the entire time, but the labor and delivery had some complications. Complications predominantly related to the periperium and other obstetric conditions, not elsewhere classified. So when you're looking at this, make sure to pay attention to which one you're on. Now, another thing to keep in mind about complications is there is such thing as more than one O code that may apply. And so as many of them that are applicable are the ones you want to list. If I look at 009, which I'm going to flip to now, supervisions of high-risk pregnancies. So if I have a high-risk pregnancy and it breaks down the different reasons that the pregnancies are considered high risk, this is typically where you'll find a lot of your conditions for patients that have issues. If the example I gave you earlier, they had pre-existing hypertension, you'll find that under the edema, proteinuria, and hypertensive disorders in pregnancies. Pre-existing conditions of hypertension are under 010. 010 goes on quite a bit, defining the different types of hypertension and how it's complicating the pregnancies. If they, however, have pre-existing hypertension with preeclampsia, which is the condition where hypertension affects the baby and mom, then it's 011. So if it's pre-existing and it has this, you'll also notice that it says use additional code from 010 to identify the type of hypertension. So that's when you would have two codes for the one condition. You have pre-existing hypertension with preeclampsia, and you have to identify the type of hypertension. So you'll have an 011 and an 010 category for that. So I've let my marker dry out a little bit. Let me switch over here. Gestational proteinuria. You have various other gestational conditions, and then preeclampsia by itself. So the difference between pre-existing hypertension with preeclampsia versus just preeclampsia is going to be, you have two codes versus one code under 014 category. So the best way to find these is always keep in mind that when you're looking for moms and babies, or for moms for pregnancies, you're going to be under your O category, and you want to look up the terms under your alphabetical and look into your tabular to break these down. Okay? Now, with all of these, we're also going to have weeks of gestation, and we get to labor and delivery. Okay, so now we've already talked a little bit about different trimesters and some of the terms that are associated. You want to identify the type of category of pregnancy that the patient has, whether it was normal or whether it was with complications, and then you're going to fall under these O categories. And you always have your week of gestation. But what happens if during the encounter or the hospitalization the patient has now delivered or is attempting to deliver? Okay, so we go back a little bit, and we have a couple of different types of labor and delivery. We have normal delivery, which means there weren't complications. Okay, you'll find these in your O categories under O80, and so I'm going to flip to that category now, which is found under page 915. Excuse the alarm going off there. That means our video is almost up. Okay, so O80, is found under encounters for delivery. You have two different types here. O80 is for encounter for full-term, uncomplicated delivery, defined as greater than 37 weeks, versus encounter for cesarean delivery without indication. So this would be when, for whatever reason, maybe mom elected to have a C-section, maybe she had a previous concerns about it, and so the code O80 is going to be listed, or O82, so vaginal birth versus C-section without reason. Okay? And in addition to this, you're also going to need to code the outcome of the delivery, which we go back to our Z codes here under Z37.0. Okay? So Z37.0, let's take a look at that for a second. Your Z37 is the category we're going to be looking at when we're identifying the outcome of delivery, so what was born. In this case, you'll find Z37.0 through 9 is for the type of birth, and these are to be used on the moms. Do not use Z38 for live-born infants. These are to be used on the babe. Okay, so you have your mom codes versus your newborns. You want to identify the category for a single stillbirth, single live birth, single stillbirth, twins, other multiple births, and the reason they list Z37.0 under normal delivery is because anything that is not a single live birth is considered a complicated delivery and would fall under our other categories for deliveries. Okay, so when we get past the normal delivery, then we want to talk about the different types of deliveries. You have some special complications, such as obstructed labors due to a breech presentation, which is where the baby is coming out butt first instead of head first. There's also different types of presentation where they don't come out correctly, so you want to pay attention to that in your documentation. Of course, we have preterm deliveries, which are complicated. Prolapse cord is a condition that they may have. So there's a lot of different things that can occur, and really it's a matter of finding the different areas. So you're going to find your complications or special circumstances under O60 and beyond. So we're going to move over to that for a second. And this is going to be in our block O60 through O77, which I find on page 911 of my ICD-10-CM book. Okay, so complications of labor and delivery are your other options for codes here. So if I have complicated delivery, of labor and delivery, and there's a few notes here, I'm going to have the complication code from 060 through 077, and I'm going to have the Z37 dot unknown for the type of delivery. Okay, so you want to remember this. So don't forget, you also have your weeks of gestation. So if the patient delivers, you're going to have any complications of pregnancy, the complication of delivery, or the normal delivery, or the normal pregnancy. And then you're also going to have weeks of gestation and outcome of delivery. So there's quite a few different things that you'll be looking at. Pay attention as you're reading through these. There's all the different types of deliveries available for moms and babes, and that's what makes this category a little complicated. Look at your read first, look at your guidelines, and you'll do just fine as you code for OBGYN, pregnancies, and deliveries and their outcomes. Until next time, have a great day, and we'll talk to you next time on CNM Glass.